Joining me in the studio today is Dr. Brad McKay. He's an Aussie doctor who you might recognise from Embarrassing Bodies Down Under or the plethora of other programs and podcasts he's been on. Okay, so we have these DMs that are normally stories or questions that people send in. We've had 2 stories sent in by some young men. Do you mind
No problem.
sharing your expertise?
That is not an issue.
Okay, here's the first one.
Hey, I was just wondering if you had any advice or insights into sort of how to manage and cope with that pressure that comes with being a young male and the expectation to be fairly sexually active from a young age. I know for me, growing up pretty much around rugby clubs my whole life, it was definitely something that I struggled with, sort of trying to balance that external pressure as well as what I was comfortable with at the time, and how I felt. So yeah, any advice for how to stay true and sort of confident in and be confident in yourself to trust what you're doing is right would be cool.
I feel like even as an adult, people are always saying they're having more sex than they are.
That's generally the case.
Yeah.
Yeah. We always like to put up a pretense. Yeah. But like for me, like it's such a weird question because I'm sort of putting myself back to when I was in my early 20s or late teens, and I was brought up in a Baptist family, and so it was like no sex before marriage. You just have to get married to your wife, and then you'll have lovely sex with her, and God will arrange everything for you, and everything will work out rosy. Which for me was really weird growing up, like realizing that I was gay and that I probably wasn't going to get married to a woman. And at that time in Australia, I couldn't get married to a man either. So it was all a bit of a confusing blur. But yeah, there is that pressure for people to be more sexually active and to be more masculine, and to show off to all of their friends if you're in the rugby club. But yeah, a lot of it is bravado, and a lot of the stories that people tell don't really happen. And yeah, as I've sort of gone through my life, I kind of realized that you just really do sex how you want to do it, and whoever you're with, it's just important with communication. And yeah, like you're not wanting to be forcing yourself onto other people. You're wanting to get consent, and I think that's sort of left out of a lot of the conversations that happen in the sports grounds.
Yeah. I think it's also a thing that happens more with guys though. Like there's I remember when I was in school, it was like the boys were having a lot of sex, but if the girls were, it was a different case. And there was always this like tussle between like keeping up those appearances of fitting into what you had to do because of your gender.
Yeah, well, if you were sexually promiscuous, you were either a stud or a slut. Like
Yeah.
that's sort of the delineation. Did you have that same experience when you were going through high school?
I was a late bloomer.
You were a slut or a stud?
I mean, I'm a slut now.
Yeah, okay, that's
but in
fine.
high school, I was just like, oh, no one talked to me.
Blooming now.
Yeah, look at me now.
Yeah.
Should we listen to the next one?
Sure. Yeah.
Hi, my name's Tim. I'm currently living in Sydney, and my question just relates to an issue that I've been having on and off over the years since I was in my late teens and early 20s, when it sort of really started to get a bit worse. And it's this sort of burning sensation, this pain that I have in the shaft of my penis.
If
in
this
the
has been
urethra.
if this has been happening since your late teens, I feel like you've left it too long to go to the doctor.
Yeah. So look, it depends on what the rest of the history is. So it may develop into something a little bit more. So I'm happy to go with the flow.
Okay,
see what the history shows
Maybe I'm
us.
jumping the gun. Let's go.
Yeah.
Let's go.
And it happens sort of, after I urinate or sometimes after I masturbate. And when it first started happening, I sort of, thought maybe it was just something I ate or drank and my body was reacting to it a bit funny, but I couldn't really put up with it anymore, sort of in my early 20s, when the pain would sort of hang around for like at least an hour or so, and it was happening more and more often. So I'd put off going to my local GP and decided to go, and they couldn't find any evidence of something like a UTI or something like that. That's sort of a simple explanation.
Can things affect your urine or your semen and cause sensations down there, or is that just not a thing?
Oh, so everything sort of like changes. If you're breastfeeding, then the taste of the breast milk changes depending on what you're eating. Your urine will change depending on how well you're hydrated and what food you've been having. And also semen is very similar as well. So that's all created. Most of the semen is created in the prostate. And so yeah, like your diet can alter the flavor, taste, smell, all of the above of ejaculate. So it can happen.
But maybe not burning.
Yeah, like it's rare for that to happen. So I'm kind of looking at this in two scenarios. So the first scenario is whether it is like a UTI, a urinary tract infection, whether it's a sexually transmitted infection. And generally, yeah, if you go to see your GP, you'll pee in a cup. The tests are amazing these days. We'll find out if you've got chlamydia or gonorrhea. Sometimes if that's negative, we'll go on and do another test looking for Mycoplasma genitalium, the PCR of that. And so that's like a bit of an occult infection. It sort of like can hang around and can cause weird symptoms. Not the primary thing that we test for, but can cause problems. But then if all of those infections are dealt with, then we're looking at other things and what else could cause burning. Could it be like a difference in the pH of the urine or the semen? Could it be something that you're eating that you're also a little bit allergic to?
Right.
And so some people like have weird and wacky disorders where they're like allergic to some of the proteins that their own body produces.
Yeah.
So like there are these sort of like rare as hen's teeth sort of situations that you kind of need to be seeing a sexual health physician and delving in a little bit further to work out exactly what's causing that burning sensation. If you've excluded everything else, of course.
I'm really keen to see where this is going.
Sure, yeah.
They did want me to go see a specialist, but they did warn it was going to be quite invasive. So I did put that off and didn't really follow through on that. It still sort of happens every now and again, but not as often as I've gotten a bit older. So I suppose the reason I'm asking for this question is there an easy explanation? What sort of explanations could there be for it? And hopefully just to bring awareness to the issue, because maybe it's more common than I think it is. Maybe there are men out there that are suffering, but they don't really know what to do about it. Thank you.
Because it might be an invasive, procedure, doesn't mean that you should not go and do it.
No, exactly. And I think part of what's going on here is more the fear of the unknown as well. So if he was seeing a sexual health physician, for example, or going to one of the many sexual health clinics that are around Australia and around the world, then often you have like these really incredibly intelligent people. And often you don't need to do anything too invasive to sort things out. So yeah, like certainly you'd be wanting to check for Mycoplasma genitalium. That would be like a no-brainer. So if he hasn't had that test done, yeah, get it done.
Is that the same test?
It's basically sending off a urine test.
Yeah.
But you've got to request it on the slip.
Right.
Yeah. The other things that you'd be thinking about that could be a little bit more invasive would be seeing a urologist. And then sometimes they'll be going, oh, well, what's happening with your urethra? Are there any ulcers or some other inflammatory process that's going on? And so they will occasionally put a camera into the urethra and look along the urethra, so the inside of the penis, and all the way into the bladder, and just sort of see if there's any inflammation, any signs of bleeding, any ulcers. But again, like normally you'd have blood showing up when you're sending off the urine. So they may not even consider doing that. Like, I think that would be very, very unlikely. And I think it's that fear of thinking about somebody putting a camera up your penis, which is stopping this person from going and getting some help, where they're probably not going to do that. The old treatment or the old testing was really getting multiple swabs and then pulling those up the urethral opening.
I think that's like still exists as legend today. Like people think that that's what's going to happen when they go and get a test, but it's so rare.
Like it doesn't happen. Like I don't think I've ever done it in my entire career.
What's worse, a COVID test or a urethra swab?
Oh, probably the urethral swab. Yeah.
But we're busting the myth. It doesn't happen.
So if you've got a discharge that's there, then usually you swab the end of the penis and you've got enough discharge there to send off. So some doctors are still in the old-fashioned idea and they will sort of like put the swab up. But yeah, like if that's about to happen, you can always say no. Like, can't I just do a urine test?
Yeah.
So the vast majority of the time, you'll just get a good result from doing your urine.
Yeah. All right. Well, I think your advice to him is go to the doctor.
If you're seeing a GP who's not that well equipped at dealing with sexually transmitted infections, then yeah, go and see a different doctor. There are many sexual health clinics around. Just find somebody who's got a little bit more knowledge in that area, and then we can do a few more tests. But it's unlikely to be invasive.
And it's normally free.
It's normally free. Yeah.
Well, should we crack on to the interview?
Sure.